Hey, good morning, buenos dias, bonjour, guten morgen, buongiorno, bon dia, guten morgen, dombre otro, madang ugmag, juan achim, saba al kahir, suben bakahir, good morgen, boker tov, daisen dobra, and buena damitia. So if you wonder why I tried to murder all those different languages, is I just looked up and found out that we are now available we're being watched by 23 countries. At our 1 year anniversary, I told us that we were at 15. So more and more countries joining in. I just want to try to make it more all inclusive with all the good mornings. So good morning. We are coming to you from euronurse.com. We come here every morning at 9 a.m. Central Time. My name is Vic Sinise, and I'm the host of the show. If you're watching us live on YouTube, Facebook, or LinkedIn, glad to have you on board. Hey, for you YouTubers, be sure to hit that subscribe button if you're new to YouTube so you can learn more about us from that. And if you're new to the show, be sure to check us out on euronurse.com. Our website has all the information you ever need to find out about the show. It's also the best place to go for past episodes. And it's got our EuroNurse Plus, our newest addition to the group, and that's got our audio podcast. A lot of people are finding those to be pretty handy. You want to listen in the car, all of our episodes are available on all your favorite places. Also, if you're not getting the newsletter, if you sign up by StreamYard, I put you on automatically, but if you don't, go to our newsletter somewhere over there and put your information in, and you'll get our newsletter, which comes out every Monday morning about 9 o'clock Central Time, or whatever your time is. It tells you a little bit about what the upcoming show is. Now, if you're watching us live, that's the right place to go. Put your comments in the box. You want to test it out? Tell us where you're from right now. Let us know where you're watching us from. Any questions that you have for us, for the group, let us know, because we're always glad to answer your questions. And this week, we got a great presentation, Lumea Prostate Biopsy System. Lais Heideman is going to be talking about that with us today. So we can't wait to hear more about that new system. And let's bring in our experts right now. Hey, welcome, everybody.
Good morning.
Good morning.
Good morning.
Great to see everyone today. So, yeah, it's going to be exciting. As always, we'd like to start out by having our experts introduce themselves and a little bit about them and a favorite story. So let's go right into that part. My name is Vic Sinise. I'm the host and producer of the show. I've been in urology for 40 years, enjoy every bit of it, and still love going into the office and doing working with patients. And then this show is a great way to give that back. So that's what that's for. Now, my favorite story, we're talking about prostate, so I'm going to kind of stick to the prostate theme. My favorite story is about prostate biopsies. How do you distract people from being nervous over them? And I found the best distraction therapy seems to be music. So I always have music playing. I have an iPad that I use for putting my information in. So I always bring that and I put a playlist on. I found that's really great. One time I was really, learned about how much of a patients can react to noise and stimuli. We were doing a biopsy, and every time the doctor would click the gun to fire off the biopsy gun, the patient would go, ow. Now we gave him a block. We knew he shouldn't be feeling it that bad every time. So one time he clicks it and it's outside the patient. He goes, ow. So it shows that patients react to audible signals. So having that music in the background takes some of it away. Now I found the best music, and it's something called yacht rock. So if you don't know what yacht rock is, I never heard of it, but a friend of mine told me about it. And yacht rock is music that was primarily created between 76 and 84. It's characterized as smooth, melodic, typically combines elements of jazz, rhythm, blues, and rock. And I got the list up here so you can kind of see what the list is. But these are the type of songs that are played. Well, I'm telling you, all my patients just go and just start grooving to the music and talk about it. It brings them back to their high school years. Hey, I remember I heard that band at this place. One guy was just telling me, we're talking about the amphitheater because we're from Chicago. I mean, it's not around anymore, but that's where some of us saw our first concerts, and a lot of stories that come out from it. But it's such great distraction. Every now and then a patient will call me on it and say, I know why you did that. That music took my mind off the biopsy. And he says, thanks. So that's my great story. Let's bring in our next one here. Andrea, go ahead and give us a little information about yourself.
Good morning. My name is Andrea Swan. I'm a nurse practitioner in Wisconsin. I've been in urology since, I guess 2010. I'm also certified as a urology registered nurse, and I'm the educational director for the Chicago Metro chapter of SUNA. And my favorite prostate biopsy distraction to grandchildren. They will not stop talking about their grandchildren. So that's my tip for today.
Yes, grandchildren are always a good distraction. Hey, John, go ahead and give us your information.
Hey, before I begin, I want to respond to your comment about your story about music in the procedure rooms. And I play music throughout the entire day because for a lot of guys, I do a lot of vasectomies. For a lot of guys, what is more worrisome than somebody working on your junk? So we play music all the time. And we play a random playlist. Coincidentally, sometimes Under Pressure would play by David Bowie and Queen. And the patients will always get a nice laugh because that song happens to be playing on the playlist. I am a private practice urologist in Gilbert, Arizona, who is paying it forward by sharing my experience in the business and clinical aspects of medicine to benefit my colleagues. And one of the ways that I'm doing that is by creating the Thriving Urology Practice Facebook group, where currently close to 2,400 US-based urology practice folks collaborate to improve our practices, and it's all for free. And when it's free, I'll say I'll take 3. And today's story, it's something that happened just a few days ago. I was at a surgery center performing cases, and before the cases start, I meet the patient, and I had a few minutes between seeing the patient and going back to the operating room. So I go to the break room, and what do I see? A bunch of fruit. You know, the fruit that comes in little cartons from the grocery store. It looks something like this. And if you notice on the right side, it's little logs of fruit. And on the left side, they're smaller pieces. Well, when I walk in there in the surgery center, as you know, it's in and out. You got to run in and out, right? It's all like everybody's running on time, literally walking on skates. So I'm trying to eat the fruit, and obviously I don't want to take a big log and hog it all. So somebody left a pair of tongs and also a small plastic knife. Well, that's not going to cut it, literally. So I go over to the drawer and I found an actual serrated knife, and I started cutting up a small piece that I would want to eat. And then I realized, man, there's so many cartons on the table. Everyone else is going to face that problem, and they want to cut it up into smaller pieces. So I just cut up all the cartons into small pieces like you see on the left side. So why do I tell this story? Why is this story important to you? Often our intentions are good. Bringing the fruit for the staff to eat, that's a great idea. You want to make sure that everyone stays healthy, stays fed, a little bit of sugar to get you going. But we need to realize that we need to be empathetic to how the staff is actually going to eat the food. Likewise, if you want to eliminate the phone calls from the same patient over and over again, make sure you respond to the message right away. That is being empathetic to that patient who has a question for you in the practice. Better yet, whomever answers phone, and this is assuming that you're answering your phones with a person, ideally, right? Whomever answers the phone solves the problem for the patient right away. That's called empathetic. Also, if you want to build up your online reputation by gathering a lot of Google reviews, you want to figure out what is the easiest way for your patients to leave you that review. How do you eliminate all friction for people to take the action that you desire? Finally, I want to remind everyone that SUNA's annual conference is coming up right here in the beautiful city of Phoenix, Arizona, where we are under another heat warning. Urologic, the premier conference for urology professionals, will be held on October 26th and 29th of 2023, right here in Arizona at the Arizona Grand Resort and Spa, and I urge you all to attend. And hopefully I will get to meet Andrea and Vic in person at that time. Back to you, Vic.
Yeah, that's great. Great story. All right, let's bring in Lais. We're going to have you, if you have a favorite story, otherwise I'll bring up your slides.
Okay, perfect. Well, first, it's a pleasure to be here with you guys. It's really great. I really appreciate and look forward to talking more about this biopsy system that we use and love. A little bit about me. I'm a nurse, as you can see, certified in urology as well. Have worked in urology for over 10 years. Really love urology. It never knew that was going to be my thing, right? Most people don't go to nursing school thinking urology, that's going to be my thing. So, but definitely love it. Not a story, but one thing I always say in regards to, prostate biopsies, any kind of biopsy, really, everybody is always very nervous. I love the music. I love, all the different stories and tips there. As a nurse, though, as a patient advocate, I'd say the most powerful and important thing you can always do for your patient is teach and explain and make sure that you let them know every step of the way what is going to happen, what is going on, what sounds they're going to hear, how long things would take, etc. Talking about grandchildren, knowing your patients a little bit more, making it a more humanized experience. Those are all really great tips. So again, not a story necessarily, but just many years of being, on the sidelines of those prostate biopsies. So
yeah, great tip. All right, let's see if I get this right. Yep, we got it. All right, take it away.
Perfect. So the Lumea Prostate Biopsy System, this, I figured we start with a little bit of just an overview. What's a prostate biopsy? Well, of course, this is not really probably anything that anybody really looks forward to. But at any point in time, when there is an indication, whether that be due to a PSA elevation, an abnormal digital rectal exam, abnormal imaging, etc., a urologist may be performing a prostate biopsy. Most of the time is that transrectal prostate biopsy. Some clinics and or offices are offering the perineal biopsy as well. A needle is used to collect a number of samples, anywhere from 6, 12 to perhaps a little bit more. And usually we used to do the little formalin cup. So a lot of you might be familiar with this guy. It comes in all sorts of different sizes, has that lovely little liquid there and a super fun label that is not fun to write on, right? Not so great. But usually you go ahead with your setup. You are setting up your 2, 6, 12 little formalin cups, making sure you have your patient information, making sure you're ready to go. It's, a little bit of work. And what we found in our transition to the Lumea boards is that it has really expedited things for us, and it's made a better overall experience for really all parties involved. So a little bit on how we transitioned. We opened a new clinic back in 2020. We wanted to offer cutting edge urological care to our patients. We found the Lumea Biopsy Board system. You can see a little picture there on the side of what they look like. And, with further research of looking on how those could serve our practice, we realized that it really could expedite things for us. And it could also give our providers and our patients a much more specific pathology report, something we really liked. For our nursing staff, it was also great because, as you can see, those come pre-labeled. Of course, depending on your practice and what samples you want to take, your label might be different. And in the back of those, you just put your patient information. So I do have here with me, and I would love to show you guys. So usually your kits come in a lovely little box like this, and I have mine open already. When you open the box, you find yourself with these little Mylar bags. Of course, this one is open already. But this is what you will be sending your sample back in. With that right there, you find your board. It comes in this nice little plastic container here. So really minimal exposure to formalin as well. You go ahead and open this guy. And in there, you find your actual biopsy board. So you see here, not only is this board labeled with the R for the right side, but it's also a different color than the left side, and also a different color from the additional board that you can use should you get a sample in one of these little areas here that maybe wasn't very good, or B, maybe you're doing some targeted lesions or something in those lines. So a little bit more here on this lovely board here. So you have your sampling, you have the right side. There's actually a microchip back here, and each of these boards has its own unique microchip that is, we scan when we send it in to make sure that it's very uniquely identifiable. And of course, a nice flush little sticker there for you to put your patient information in. So really, really like these, really expedites the setup for those prostate biopsies. And additionally, some other things that we love about the board is that it maintains your specimen anatomic orientation. So instead of, pulling that needle back, putting that tissue either on formalin, so it'd float down, or on a sterile sheet and then transferring to a cup, it sticks to this little sponge here that is soaked with formalin, and it preserves that specimen exactly how it was taken. So anatomical orientation, you're able to, as the assistant, to see if it was a good sample, the size, is it too small? Did it break up? Should we do another one? You name it. Again, it's a very stable environment for fixation. This is not a cup that maybe you accidentally bumped into, and now you have samples in formalin everywhere. This just lays flat on your surface. It reduces, the opportunity for overfixation if you're transferring it into, say, a sterile field and then into your cup. And of course, the quality for the pathologist who's going to be looking at these samples is great. Again, this has really helped our practice in expediting the setup. There is about an 83% reduction in container labeling. It really simplifies things for us because, again, these are pre-labeled, ready to go for your day-to-day routine biopsy. It's a much faster procedure room turnover. And there's that instant feedback to the provider on the quality of the tissue. Now, I did want to show you guys. So you see there are 3 different boards there, a left, a right, and one that is labeled X1. So X1, every kit will come with 3 of these, but you can also just have additional of these in the room of the blackboard, because let's say you messed up all the samples on the right, or you want to take more, or you're doing an MRI fusion prostate biopsy and you're simply, doing additional samples. You have this little guy here. So that's your X1. You can see it comes blank. So for example, if it's, too short of a specimen that you took on the right, and you just want to take another one of that base, you're going to go ahead and put that in there. You can quick label that in there as well. And same thing comes with the patient labeling there, and that microchip as well. So that's pretty great. And these are all, together in one kit. Now, step by step, once you are, done performing that biopsy, you have all your samples, you are ready to go, you've helped your patient out, and now it's time to get going and get this packaged and sent out. So all these little things that you see here, so the board comes with this lovely plastic cover here. So that right there, you can see that little sponge. This one doesn't have formalin, by the way, because it's just the sample one. So not to worry on me touching it, but you have your little sponge. You get your samples in there. Of course, when you're done, you simply replace that right there. And you put it back on your little plastic container. So nice and safe there. It just snaps on. And then before you place it back in your little Mylar bag, you would be scanning it into the system, into the portal. And from there on, you ship it, whether it's FedEx, UPS, whichever, and you do get the results 24 to 48 hours. Now, step by step here on how this kind of, goes along the way, but in a little bit more detailed information. Again, when you're preparing for that biopsy, you have your box, you have your lovely biopsy gun, you have your needle, and you have all, the additional things, your numbing and patient checks and covers and consents and such. But when you are setting up your mail stand or wherever it is that you're going to be putting your boards to assist your provider, you make sure that you have all of your little Mylar bags. You open those guys up and you get your samples. Make sure that you're labeling it with your patient name, date of birth, of course, the physician that is performing that biopsy as well. You do want to remove all the plastic from it, to make sure that you have the boards ready to go. This does not, have a time frame that, oh my gosh, if it's been open like this for 10 minutes, 20 minutes, it's going to dry out. It's all right. You go in there and you put those in and you take your samples. Of course, should you need, I would always recommend, of course, having, this X1 here on hand, just in case, again, you are doing additional biopsies, etc. You do replace the cover when done, and loading, once you're done loading, you put it back. So once you put all the things back, put that back on your little plastic there, you replace it on the Mylar bag and it snaps back on. And then you're putting these bags, shipping them out. The Lumea system does come with a portal, and they do have their own pathologist that does the read for the prostate biopsies, and they do have a somewhat unique reporting system. So we currently here at our clinic have a full integration. So our EMR is integrated with Lumea, which means that we can place an order, they get it on their end. It makes things a little bit quicker. But that's not a barrier. Should you not have that integration, you can still use the system when you partner with Lumea. You get a login to your Lumea portal that's specific to your clinic. You go ahead and you have logins for all technicians or assistants, your MAs and nurses and whatnot, and your providers as well, of course. You get one of these little lovely scanners right here that is a plug and play to your computer. So it just connects into that USB port. And when you're ready to send it in, you scan this lovely little microchip there, and it identifies who it is. You match the patient demographic information into the portal, and it will ask additional questions such as what the PSA was there a nodule, any other potential commentary, was there imaging that was done, anything that might be pertinent to that read, or that might help that pathologist, you can enter in there. Once you enter, send it through, you send a sample, you can see on the portal all along the way where your sample is. Oh, it's in Phoenix, Arizona now. It will make it to California or whichever. And we do get those results back in 24 to 48 hours. So Over here, you can see a little bit of what that biopsy report looks like. So what I personally love about the report is that it comes in a 2-page format. So this page is the first one, just kind of cut in half there so we could fit on the slideshow. And of course, it will say basic things like the patient's demographic information, who the pathologist that read it is, the ordering physician. It is color-coded. And so anytime you see that red, it means it's, a positive biopsy. So there's malignant tissue that was identified. Anytime you see the green, that is benign tissue. And so you see right there, there's a box for any potential comments that the pathology wants to make, and a little bit of a prostate diagram there, which actually looks, for better imaging, a little bit like this guy here. So you have your prostate and you have your seminal vesicles, and it has, in this case, the exact labeling that you would find in the little plates, the boards. And so, of course, this is not a pathology report, but if it is positive, you see it there. And not only does it show you the location, but it does show you how much of the tissue and where exactly on that sample, on that tissue, that cancer was found. And so if you look to, the picture on the side a little bit there, you can see that, again, what's written in red is positive, and it will show you, oh, this was 80% of this tissue, 20% of this tissue. This was the orientation, etc. Very specific. It also even includes a picture of what pathologist was looking under the microscope as well. This is all, of course, for the physician to interpret and discuss with the patient. Now, the other part is a patient-focused page. And so this is the one where you see a little bit of that prostate that we were chatting, and it does show there the positive areas are in red. Each of them has that Gleason score in there. And it even has a representation of where that cancer was found and what part of the tissue, and even the orientation. And so from a patient's perspective, because it's hard to kind of put that concept in, when we're going in, taking that sample, this is kind of, the orientation of how that sample was taken. Now, I understand in many forms of treatment, say a radical prostatectomy, the whole prostate is removed. But, in there's various other treatments that are more specific nowadays. So for someone who maybe, let's say, only had 1 out of 12 cores positive, and they really want to do, HIFU, or it might be, my help with the radiation treatment, you name it, implantation of seeds, etc. So it's really nice because, again, it gives you that very detailed information. Additionally, and not represented on a slide here, the other thing that I mentioned that is very nice in utilizing the system in the partnership with Lumea is that their pathologists and our physicians work together to kind of create a pathway, so to speak. And so, it would be something in the lines of, okay, if I have a patient who has family history and has 4 out of 12, 3+3 cores there, but it's someone who is really nervous about, what should I do? How aggressive should I be in treatment? Then, the pathologist is already sending that tissue for additional testing, genetic testing, whether, that be anything like a Polaris or Decipher, you name it. So by the time the patient comes back to our clinic to talk about their pathology and what their options are, not only do we have the pathology report, but oftentimes we also have that additional testing. Again, it's kind of on an algorithm, a pathway there, so it's not a must that every patient does. Also, this is something that the patient consents to, of course, ahead of time, but it has most certainly been tremendously welcomed by our physicians, our patients, and it has been of great success here in our clinic. So that's kind of that. Any questions, I guess? I see maybe some questions were coming on the side there.
Yeah, that was really great. It was fascinating attempt or new changes in how we get our biopsy samples. Now, being around forever, when I first started out, it was 2 bottles, left and right.
Yeah. Yeah.
It was all the samples went from the left side went in one bottle, and from the right the other. And the thought was, you're going to be treating the prostate as a whole anyway, so it didn't really matter. Well, of course, they also only did 6 samples, which then became 8 samples, which then kind of settled in on 12, I think, for most people. But separating them out as to where each of those samples comes from is more diagnostic, more helpful. And then going one step further with showing exactly the orientation of the cancer may also give some clues as to what, how is it surface versus deeper in. Really fascinating. Yes, our questions are open, folks. Go ahead and put your questions into the box, anything that you want to know about. And Andrea, you'll be shipping those up for us, and we'll take those. But I'll put it over to the panelists first. Anybody have any questions or comments they'd like to make from the panel?
Thank you for that excellent presentation. I really love the patient-focused tab that you have for the patients. I think they're really going to love that.
Yeah,
I agree. Yeah, they do. It's great.
John, any thoughts?
Yeah, most pathology reports will have that cartoon diagram to make it easier for the patients to look at and say, here's the cancer. And then it tells you the percentage of the core that's positive, also the Gleason score. My question for Lais is, do you work for Lumea or do you work in a clinic that uses Lumea?
Yeah, no, that's a great question. I do not work for them. I work in a clinic who uses their service.
Got it.
Yep.
That's neat that they created that integration. And just for the folks who are not, I think we may have a patient who's watching live on YouTube. Just for the folks who are not in urology biopsy, this is what a standard biopsy kit looks like. You have 12 bottles and you have these blue squares on which the biopsy sample is laid. And the nurse kind of holds it in her hands, and then I open up the biopsy needle, and then I laid the sample in this, and then this square is then placed in one of these little bottles within the box. And typically it takes less than 10 minutes to actually do the entire procedure.
Yeah.
Yep. Very quick.
So while people are putting in their questions, I just wanted to say good morning to everyone. So we have good morning here from Chicago. Good morning from Seattle. Good morning again from Chicago. Good morning in Centralia. Good morning in Friendswood, Texas. Good morning from Maryland. Good morning from New Mexico.
Wow.
And it looks like we do have some questions coming through. One general question, it's very thoughtful, is would you personally subject yourself to a transperineal or transrectal biopsy?
Well, I'm guessing that was probably aimed at me, since I don't know it's not you girls. And thanks. I think this was probably from somebody who, I saw another question that they're worried about a prostate biopsy coming up for themselves. And I think it's a good question. Would I personally go through biopsy? I mean, I haven't fortunately had to be subjected to it yet. I don't know that I won't someday, probably, if you look at the odds. However, I did have my younger brother who had to have a prostate biopsy due to a elevated PSA. And he did have a transrectal ultrasound. It's kind of the standard of care that's offered. Now, I know there are options for transperineal, but usually those are restricted to cases that are specific for that reason. Somebody that doesn't have a rectum because of cancer surgery. I think that one of the concerns that the patient did mention was like infections, etc. And it is a concern. Any of us out there that are involved in prostate biopsies know that you're going through the rectum, which is impossible to sterilize, and you can take all the precautions in the world. It doesn't guarantee you. However, I can say that I think most physicians do practice, based on the area they practice, with these things called antibiograms, where they can find out what the best antibiotics are to use to treat you ahead of time to prevent that from happening. And the success rate of that is really high. Panelists, do you have any other thoughts on that?
Yeah,
You
when
can
I talk
also-
to the patients when I counsel the patient before the biopsy, I always disclose to him that there is always a risk of infection. It's usually occurring in less than 4% of the time. And of course, most urologists should be giving antibiotics before the biopsy and also the biopsy. And you don't have to give multiple days. The recommendation is to give one before and one after. Local antibiograms is also a good idea. The advantage of transperineal is that you eliminate the rectal entry. And the thought is to decrease the risk of infection. But going through the rectum, you're going through rectal mucosa. Transperineal, you have to go through the skin and then go through the prostate. Often the transperineal, it may be a little bit more difficult to anesthetize the taint area. Tom, you're asking this question. I don't know if you're in healthcare, but the transperineal area is a piece of skin, or the taint area. So you do have to anesthetize that area. Some patients may not tolerate it as well. And some urology practices are doing it under anesthesia to make it more tolerable for the patient. Most urology practices in the US are performing transrectal biopsies. Seems to be the standard so far still.
Yeah, thank you.
You'll see a lot of different preparations for prostate biopsies across the nation. I have seen offices have patients do an enema, like a fleet enema, the morning of or the night before, or perhaps both of those times, to help reduce the amount of fecal matter that's in the rectal area. I've seen some clinics actually use basically an enema of iodine into the rectal area to try to sterilize it as much as possible. As Dr. Lin said, it's impossible to get that area completely sterilized. I've seen some clinics do rectal swabs. So you would, during the digital rectal exam, you put a small Q-tip into the rectum, or if you get a small amount of stool from the finger, you can put it on that swab and send it to the lab. What they're looking for is fluoroquinolone resistance. Fluoroquinolone is, we usually use Cipro, and that is a medication in that drug class. Some patients do become resistant to that antibiotic, which means if we give you Cipro before a prostate biopsy, it won't work to prevent infection. So in those cases, they may choose a different type of antibiotic to prevent infection, usually based on the local antibiogram. In our area, we're using Rocephin. So those are some of the methods that I've seen to prevent infection.
Yeah, thanks. Any thoughts, Lais, on that in your office? What's your precautions or prep you use?
Yeah, so you guys covered a lot of it. So our standard is transrectal. Still, we're actually going to be starting to utilize Promaxo, which again, another story here with the transperineal. But we do have every patient do an enema. They start on oral antibiotics, and then, they do get a Rocephin shot as well, just to, of course, when they come in for their biopsy. So we are in in central Iowa. So, our community bacterial resistance is pretty low, but we still take those precautions to assure our patients are safe and have very low rates of infection.
It's interesting. I did some work for the SUNA group and the AUA, which is the two major organizations for nursing in urology and for urologists, medical and urology, on the problems and the complications with prostate biopsies. And so I gave a talk to my nursing group, and it was the SUNA group, which was attended internationally as well as locally, throughout the U.S. But some of the people that were there were from England. And after I gave my talk and talking about using the enema as a prep, ahead of time, they came up to me and said, "You Americans and your enemas, you put patients through unnecessary procedures." They said, "That enema doesn't do anything, show me your evidence." Well, I agreed. I said, but listen, I said, on our side of the pond, if I tell a patient he's canceled because I find that he's got a constipated bowel and I can't get the probe in, I said, they're not real happy. People in America don't like missing work. I said, maybe in England it's not so bad, when you miss a day off to have to be re-prepped. And they said, oh, okay, maybe. So there was a little give and take on that.
Yeah.
But yeah, I think that the prep is important. And do we have any other questions coming in there, Andrea? I haven't really looked.
Yes, we had a question on what is the cost comparison?
Oh, that's a good one. Yeah.
Yeah, so I don't have the numbers here with me. It is, comparable, we'll put it this way, into what it would be to partner with a local pathology lab. We don't have our own. We do partner solely with Lumea, but overall, even without the numbers here in front of me, it was not only about patient care and the type of service that we wanted to be able to offer, but also it made sense from a cost comparison.
And covered by insurance, I assume.
Yes.
Another question we had come in was, can you send Lumea pathology to another facility for a second opinion?
Yes, you can. So they are a normal pathology, lab as any other. And so if you move or you want a second opinion or whichever it is, you can request those slides to be sent elsewhere. Mm-hmm. Yep.
I think that the real advantage has got to be speed doing that with the system.
It does. It's very, it's very, very fast. Set up as a breeze. Very much a breeze because we just keep the boxes, the Lumea sample boxes in our procedure rooms. You pull that out, just bam, 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 patient name. Very fast, very, very fast.
And the sponges are pre-soaked with the formalin. So when you're working with it, do you smell the formalin in the air? Like typically when
Not
you open
really.
up those bottles?
Mm-hmm. Not really. It's very, very minimal. If you were to touch it or look very closely, you can tell, but it's very minimal. You cannot smell it. It's pretty great. So
that's a big advantage to the people that are in the room doing these day after day.
Mm-hmm.
I mean, a patient obviously gets minimal exposure to it, but there has been some healthcare issues with formalin, being inhaled on a regular basis. So
yeah, no, it's nice. And, if you keep all the little, the plastic covers around, and once you are done with each, which this is the other thing, as a nurse, I've struggled in the past trying to do things fast and like recap one of these real quick. So I'll move on to the next one. And these, it's very, very easy. You just put that on. So just then it's capped. Then, if there were to be any smell or whatever, it's just covered. And I also like the no spilling. I've spilled it before. I've spilled a cup before. So
I was just going to make that comment. I've spilled them too. You knock them over and you got that formalin all over the place.
Panic mode, right? So that does not happen with these, which I really appreciate.
Well, we try to mitigate any bad things or unexpected things happening, and we don't have that spill problem. And I do not smell. Yeah, I do not smell formalin at all. This is the kit in which the specimen jars come. Before the biopsy starts, the MA unscrews all these containers, and as I'm doing the biopsy, she captures it on one of these little squares, and it is immediately placed in one of these jars. And I always perform the biopsies in the same sequential order.
That is key.
We train our new MAs. Okay, Dr. Lynn's going to put it in the right lateral posterior first, and then right posterior lateral medial, and then mid, and then apex. So there's really not an issue with spillage because the containers, unless you spill the entire box, you're not going to spill any formalin. Also, we have a fan going all the time in the procedure rooms. So we don't smell the formalin, first of all. And number two, the vent is constantly it is exchanging air all the time. Every single one of these jars is labeled with the patient's unique identifier. So it is less work for the staff using the Lumea system. But on the other hand, you better make darn sure that the chain of custody for that specimen is not broken and the labeling is perfect. we have our own chain of custody protocol that we follow in the procedure room for prostate biopsies. Imagine putting in the wrong sample in the wrong jar, and the wrong patient gets diagnosed, which has never happened here, but that's always something that I worry about, and we take steps to mitigate that issue.
Yeah, no, I mean, likewise, you know, a kit, whatever kit you use, you still got to use it right. So same thing. So our kits are, you know, with the pre-labeled, and all of our physicians follow the same order. Everybody, you know, always starts from, you know, the right and then go to the left, and then you go to your lesions, and you always do, you know, the base first and then lateral, etc. So if is going to be something different, I don't know, for whatever reason, today we want to just do lesions or whatever it is. Of course, the physician's having a conversation with the MA, and they go into the room prepared, right, so that they know what it is that they're doing. Absolutely, that's super important.
And to answer Tom's question, who's watching on YouTube, regarding your transrectal versus transrectal and the risk of infection, if you will, the best person to ask would be your urologist based on his or her experience regarding biopsies and the risk of infection in his or her hands. And to answer cost comparison, Katie posed that question. There is no difference in using the Lumea system versus the regular biopsy system because the cost, there's several factors. There's the pathology cost, which is not going to be any different using the Lumea system. The Lumea company would incur the cost of those kits. It just makes it easier for the pathologist to run those samples. It's more efficient for the urologist. May not be more efficient for everyone, but the cost to you from the urologist should be the same, as well as from the pathologist. Should be not any difference in the cost.
Yep, absolutely.
And Susie asked, can you send a specimen to another facility for a second opinion? What happens to these biopsies once it's taken to the lab? They'll mount it, and then they will slice the pathology samples using a microtome. And then that sample is then mounted on a microscopic slide. When you send a specimen off for a second opinion, that slide is sent to the pathologist, to the second opinion pathologist. So yes, you can send the slides for a second opinion. That's not an issue. Now, taking more samples from the microtome block, that's a totally separate thing. And that's usually done for genomic studies.
Right.
Yeah. No, you're right. Where, you know, these boards or formalin cups or whichever, they're just means of transportation for that sample, right? From your urologist's office to the pathologist's office. And then, you know, from there on, they're just going to be on a slide. So.
And I'm sure for the microchip, the RFID identification, don't you have to put in matching patient demographic information? You don't just scan it. It's not really that easy.
No, you do have to match. And so, of course, yes, the microchip and, you know, the board has the patient information, but you do have to match that patient information on their portal. It is a little bit easier for our clinic because of the integration, meaning when we enter the order in our EMR, it's already waiting in the portal. And so you just select, John Doe, boop, and then you scan and that matches, to John Doe. But you can also easily enter that demographic information.
I think the one point is the Lumea system. I think it certainly looks like it'd be a faster turnover time in for the working of it. But some of the big organizations now, these big conglomerate of urologists like we belong to, have their own pathology department. So which kind of eliminates us being able to use the Lumea system since it's part of the Lumea system. So you have to be part of that. So it won't be available for everybody because of that. But who knows? Maybe these cartridges might come out as a separate thing that other companies can use.
Yep, that's right. I mean, who knows, right? As everything continues to progress, maybe there will be future partnerships or other companies that might come with similar boards. So never say never.
That's right.
Well, there's always an opportunity for collaboration between Lumea and also the existing pathologists.
Absolutely.
Like the split TC, PC type of billing system. The TC is done by Lumea, and then the PC is done by the LUGPA group, the pathologist that is hired by the urology group. So there are always ways to creatively make this work.
Absolutely. Yeah. And each clinic will have their own partnership. So
we do have some comments coming in. Katie Bortel said, very good presentation and thank you for the information. We also have a comment from Tom. Your work is so vital. You make the world a better place. Thank you.
That's very nice, Tom.
Appreciate your kind words, Tom. Best of luck to you in your upcoming biopsy.
Yeah.
Yep.
So I was going to say, one of the things I noticed is, of course, being around for 40 years, you see progress. I mean, when we started out, we used to take the needle and dip it in the formalin jars to get the sample off. And then somebody thought it was a great idea to try to fire it into the jars. Well, I never got credit for it, but those little sponges that everybody's become so popular with, I think I invented that, because early on in my career, I decided that was like way too much work to try to do that. And I took cut out a sterile sheet that we use for surgeries and marked it right and left, put down the sections, and then the doc would just load them off onto the sheet. And then those little things cut into squares that I would then put into the jars. And the pathologist who was getting them kept saying, wow, these are really great. I like how good these samples are coming out. And then eventually these sponges came around from that, but never got credit for it. But sometimes good ideas go far.
Well, despite my youthful Asian appearance, I remember the days of doing biopsies, not with an ultrasound, but with your finger guiding the needle. So the fingers in the rectum, and then using the needle, and you're guiding the needle into the prostate.
Those were brave urologists. That's all I can say.
Seen those around.
Yeah. Well, any other questions out there? Feel free to put those in. Otherwise, I think we're getting to the end of our show.
Vic, I'd like to just briefly talk about a little bit about the patient experience. And I think we've all kind of touched on this, that the sound of the biopsy gun is perhaps one of the most terrifying pieces of having one of these biopsies done. When I was working in the clinic doing telephone triage and prepping patients for this procedure, I would warn them that one of the most disturbing parts of the procedure is the sound of the needle firing. And I warned them that it sounded like somebody slammed their hand down on a stapler.
Yes.
And then in the clinic, before we did the procedure, the physician would go ahead and fire the gun before putting it in the patient at all, so that they knew what it sounded like, they knew what to expect. And another piece is you don't want the patients to be jumping at the sound of the gun, because then you can have more sampling errors. I don't know if anyone else has tips on patient experience around that.
That's a great tip. Yeah.
That's a real good tip. I always say it's not a starter's pistol. Don't jump when they hear it go off.
It is true. I do. I mean, I have, one here with me. It is quite loud. So, it's the back and forth. It's kind of loud. Don't know if you guys can hear it. And then when we fire it, course.
Not while fire, right?
Of course. There we go. And when you fire it, it's quite loud, And then you hear nurse and physician talking and clicking back and forth and this and that and just this again and again. It can be.
That's why you need that distraction therapy.
Yeah.
The music, anything you can do to keep their minds off of that clicking sound and the noise and everything else. I always equate it to the dentist drill. When you're sitting in the waiting room, you hear that drill going. I mean, I just cringe.
Yeah, no, it's true. It is true, that sound, right? And I agree. Our physicians do a great job of firing that gun to say, hey, this is what it's going to sound like. You're going to feel pressure, etc. Always letting the patient know what's going to happen next, so that it's not a surprise, right?
Well, Lais, because of the auto muting and the sound conditioning that is done by StreamYard, it does not sound really loud when you just fired off the biopsy device.
I noticed that.
I will tell you, I'm going to be the contrarian. I don't think it's that loud. It may be surprising. It may sound different to what the patient's used to, but I don't think it's that loud, especially think in terms of the patient. He is supine in the left lateral decubitus position, and then the biopsy is done on the other end of the ears, like way on the distal end. Also, you're behind the buttock area, and there's some drapes. So some of the sound is dampened. And the fact that the needle, when the needle fires, it's not, I don't think it's that loud. It's just surprising. It's like an automatic stapler going off, maybe. But what you mentioned, I think, Andrea, what you suggested or mentioned is that firing the device outside of the patient so that he knows what to anticipate, I think is really, really important. So he is not surprised when the actual biopsy goes off. Unlike some of you, my patients don't really jump because they kind of know what to expect. So there's not really jumpiness. And I think patients tolerate this really well. It is extremely important for the urologist to be very, very efficient. After getting the sample and delivering it onto this square. Some urologists will take the sample, hand the biopsy device to somebody else for that person to deliver the sample onto the square. I do not do that because anytime I hand off that big long needle, that's a chance of somebody else getting stuck. So here's the pro tip. Take the sample, have the MA, have the square very close to the anal opening. You open up the needle, deliver the sample with the minimal motion, moving the tip of the needle, delivering the sample onto the square, and then cocking it, getting it back into the ultrasound probe before you go on to the next biopsy. That's how you can do this typically in about 5 minutes.
Yeah, absolutely.
Great
I always
tip.
say that my trick is when I give the antibiotic injection, I always count 1, 2, 3, so that they kind of have a idea when it's going to get ready to come. And I think the same thing for the biopsy. Don't just come and surprise them and click away. Let them know it's coming. 1, 2, 3, whatever you want to do. Here, we're going to do the sample now, whatever. So the patient's not surprised. Take the surprise factor out. A lot of times when I see how they react to the biopsy or to the injection of antibiotic, I get a pretty good idea how they're going to do on the biopsy samples too. And I'll tell them, some people will actually jump when you give them their shot. And I'm like, hey, you can't do this. It's dangerous. So it'll be a needle inside you. So I think the expectations, if you set those perceptions up ahead of time, it really helps. Well, this has been a fantastic show. Really appreciate all the comments. I think we got a lot of good information on biopsies covered today. So that's great. I'm going to put a plug in for next week's show. Hey, it's Labor Day coming up. So I don't know how many people were going to come. I decided I would do another talk, and I'm going to talk a little bit more on AI. I've been using these YouTube shorts and reels to help promote the shows. They're little 1-minute skits, but I'm going to show you how easy it can really be using AI to do a lot of the heavy lifting for you, but it doesn't do it all. So I'm going to go through some of those tips for next week's show. Join us for next week. And all of our experts here, appreciate always having it. Couldn't do this without you guys. Thanks for all your help. And a new one to the show, Lais. That was a great presentation. You did excellent. So
thank you for having me.
Enjoy. I know school's back in. I saw the school buses out. So summer's almost over. But whatever's left, go out there and enjoy it because it's still summertime. Have a great day, everyone.
Bye-bye.
Bye.